There are only a few H1N1 vaccination companies in the world, thus making it a global shortage of the vaccine. The Pan American Health Organization has secured a certain number of doses for its member states, and Turks and Caicos will be getting its vaccine through the Bahamas PAHO office. But unlike our neighbors to the north, the Bahamas has been receiving delays on their H1N1 vaccination for months. But according to TCI Chief Medical Officer Rufus Ewing, the vaccine is on its way right now.
Well, the one that is coming to us, the batch that's coming to us is already en route. It's already been shipped. It actually was supposed to have been here about around the last weekend, it's Christmas week in December, but they wanted to ensure that it arrived not during the holiday period when offices are closed, because the vaccines are very time and temperature sensitive. So we have to make sure that when the vaccine is shipped, it can be collected in the same day by the relevant persons and stored appropriately.
And after its arrival to the Turks and Caicos, the Ministry of Health will be launching a vaccination campaign which will start in January and run into February. Ewing said the first batch is not enough, therefore they are prioritizing groups.
Definitely, we will not have enough vaccine to cover the entire population, but we have certain high-risk groups for which we will prioritize to receive the vaccine. We have developed our communication plan with regards to who, when, and how those individual groups will get. We'll be launching that communication plan in the coming week, probably the next week and a half or so.
Ewing said that TCI also has another source in the UK that will provide additional H1N1 vaccines. He said with that, the Department of Health will be able to cover a significant portion of TCI's population. There are currently 44 confirmed cases of the H1N1 virus in the TCI, but according to Ewing, those infected persons do not need the H1N1 vaccine because they were already treated and they would have already developed some natural immunity to that particular strain of the H1N1 virus. But is this a sense of urgency? He said that rate has not increased dramatically as expected, but we are still in the winter season or flu season, and the Department of Health is expecting some flu patients.
We expect that there will be an increase in number of flu cases. Hopefully we can keep that under control, and we're just waiting for the vaccine to arrive. The earlier we get it, the better. So I guess from that standpoint, there's an urgency, but it's not an emergency situation. Okay.
Ewing is urging all residents to tune into the various media houses for information and instructions with regards to the H1N1 vaccine. He said this information will tell how residents can go about getting the vaccine. For WIV4 News, I'm Takara Bain.